There's two types of main tests. One is going to detect the virus directly. It's only going to look for the virus. That's called molecular testing or PCR. So that's the gold standard. That's going to be the most sensitive and the most accurate. And unfortunately, that's the test that takes the longest and has to be done in a professional hospital or clinical lab setting. So that's done with a nasal swab or a nasal pharyngeal swab, which is the very uncomfortable swab, I know, but it's going to give you the best results and the most accurate representation of whether or not you have the virus at that particular moment. It's not going to predict whether or not you have the virus in the future or the virus in the past. It's reflective of that moment when you took the test. The other big testing that's out there, and this is what a lot of those tests fall under for rapid testing, is the antigen or the antibody testing. This is serology testing. This is what it's also called. I know, and that's part of the confusion, is all of these things have different names. In general, serology testing is going to be less accurate than molecular or PCR testing. And so if you really want to know whether or not you have had or you currently have the virus, you're going to want to go with a molecular test. If you're asymptomatic and you are maybe just potentially exposed, serology testing is an option. The only thing you have to be aware of is that a negative result with serology testing doesn't necessarily mean a true negative. It's less sensitive. And so for some cases, if you get a negative test, your healthcare provider might recommend you still get a molecular test to confirm that you're truly negative for the virus.